Hi, everyone. So we are going to be sharing with you our case study. Our case study is with Jay, and Jay was referred to us by his parents. He was 4 years old, 6 months, and has been stuttering for well over a year. His parents were advised initially to just ignore the stuttering, and they reported that their son's stuttering as coming and going. It was primarily in the form of repeating the first word of a phrase, k, k, can we go, at the time of the referral. However, the stuttering has gotten more pronounced. There was more tension in the sound of the disfluency, and Jay began stuttering on the first part of the word, k, 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 can I go? Jay's grandfather on his father's side had severe stuttering as a young man. I explained to his parents that we would work directly on Jay's stuttering and that we would call it bumpy speech, and that I would, in a very calm and matter of the fact way, explain what stuttering is and show Jay how to say words easier. Our client Jay is on an IEP because he's 4.5. The school speech language pathologist would not typically use the LIDCOM method because parents don't typically attend the sessions and the therapist can't regulate the parent's participation. Therefore, this method would more so be seen in a private practice or clinic setting.
Thanks, Anna. So now we're going to talk about the LIDCOM strategy method. So the LIDCOM program is designed for preschool-age children who stutter. It's a functional carryover method which SLPs work with the patient or the parent on behavioral behavioral approach to address stuttering with verbal contingencies, praise and verbal feedback about the child's speech. If you all remember the continuum of naturalness, this is high on the spectrum because the parent is taught by the SLP and the parent gets to support the child in their natural environment. There are 3 levels. So least to most natural, clinic, hybrid, and home. The role of the SLP using the LIDCOM program is to teach the parent strategies weekly at the weekly visit, as well as ensure what the parent is doing at home is being done properly. The SLP also instructs the parent on rating the child's severity of stuttering, called severity ratings. This is a routine part of the LIDCOM program, and it is important for the SLP to explain the importance of severity ratings during the first clinic visit. Parents assign the child a severity rating each day, and clinicians assign a severity rating during each clinic visit.
Okay, so we're just going to go over the steps of the LIDCOM program. The parent and child visit the clinic each week. It's once a week during stage 1. The parent records the severity ratings each day of the week. Sometimes this can be done via a private electronic account, as it holds the parent accountable for recording the severity ratings each day. This might be a little more effective than having the parent write it down and bring it in, because then they might be writing it down just right before they come in and just trying to remember. So this ensures that it's written down each day and the parent is recording it every day. The level of severity rating will determine the next steps to take in the intervention. Once stage 1 goals are achieved, the client moves to stage 2 and is seen less frequently in the clinic. And this is a maintenance stage at stage 2.
So now we're going to be role-playing the LIDCOM program. I will be playing the role of SLP, Sarah will be playing our parent, and Sandra will be acting as our client, Jay. Thanks for coming in today. How did Jay's week go?
Hi, Jay had a pretty good week. I noticed his speech is becoming more smooth each week, but he still stutters quite frequently. I noticed that he stutters more at home than when we're in public settings. Looking at the severity ratings, I would say his average is at a 6 this week.
As we discussed a couple weeks ago, remember the first part of this program is verbal praise for non-stuttered speech. During regular daily activities, you want to give him praise on his smooth speech. Some examples of praise you could say would be, "That was lovely smooth talking," or "Good talking, no bumps." So, how did your birthday party go, Jay?
I had so much fun at my party.
Wow, Jay, I heard some good speech sounds when the words fun in my party. Your speech sounded very clear.
I like the way that you commented on the part of his sentence that was smooth. Have you found a certain phrase that Jay seems to respond best to?
Yeah, I think I'm becoming better at giving positive feedback. We have made it into a fun turn taking game, and Jay really enjoys that. He is really proud of himself when I tell him that he had smooth speech.
Jay, tell me what you think about the turn taking game.
It is fun. I like it when mom tells me I have smooth speech and I get stickers.
It seems like this is going well for both of you at home. We can move into the next type of verbal feedback for stutter free speech, where you will request self evaluation. You can do this with his non bumpy speech. During conversations, ask him questions like, "Was that smooth?" And expect the response, "Yes." Or, "Were there any bumps there?" And expect the response, "No." Let's try that in our next conversation.
Now we'll shift into therapy.
Okay. Jay, what did you eat for breakfast this morning?
I had a banana.
Jay, do you think your speech was smooth?
This was a great job asking him about his speech, but remember, we are only going to use this during his non bumpy speech.
Oh, that's right. Thank you. Jay, what did you do after breakfast this morning?
I rode my bike.
Jay, was that smooth?
Yeah.
That's right. Great job, Jay.
Both of you are doing a great job. Another way to give positive feedback for stutter free speech is to acknowledge those by just giving matter of fact statements such as, "That was smooth," or "No bumpy words."
Verbal feedback for bumpy speech is introduced after the positive feedback is going well. So as you can see, we just worked on the positive feedback for just the stutter-free speech. This type of feedback, when we're going to move into the what is called negative feedback, or it's feedback for the bumpy speech, the type of feedback is first acknowledgement. You're going to say things like, "That was a stuck word," or "That was bumpy." And then the feedback is going to be things like requesting for self-correction. So parent might say to the child, "Can you say that again?" Or "Can you say that smoothly?"
So this next session will be 12 weeks later, and this is when Jay's stuttering is measuring at a 1 on the severity scale.
And for this part, I will be the SLP, Sandra will be Jay,
Jay's mom.
Jay's mom, and then Anna will be Jay. Okay. It's good to see you both again. How has everything gone this past week?
Really good. As you have probably seen on our chart, Jay's severity ratings were at a 1 every day this week, just like last week.
Jay, how do you think you are doing with your speech?
It's really good. I don't get mad now when I talk.
No bumpy speech, Jay.
That's great. You both have been doing a great job. And Jay, you've made so much progress with your smooth speech. Now we get to move on to our next phase of treatment. This is called the maintenance stage, and we will follow a different clinic schedule. I will plan to see you in 2 weeks, and then again in another 2 weeks. We will check in and talk about how everything is going for Jay. Then we will meet for 2 visits 4 weeks apart, then 2 visits 8 weeks apart, and finally 2 visits 16 weeks apart. The schedule normally takes a year or more. Sometimes an individual will regress slightly, which is okay and quite normal for this to happen. We will adjust our schedule according to that so that Jay stays on track. He has done a great job so far, and I'm sure he will continue to improve. See you again in 2 weeks. Reach out if you have any questions or concerns before then.
Thank you.
Thanks. Okay, I think.
Oh,
It still
So
says it's recording.
yeah, it's